Right. Have we got everybody that are we expecting to come?
I think so.
All right, well, if everybody's here, we'll go ahead and get started. Good afternoon, everyone. I'm Jessie Ferner, Executive Director of the Bucyrus Area Chamber of Commerce, and I'm co-hosting today's event with Miranda Jones, Executive Director of the Galion-Crestline Chamber. Our presenter today is Ryan Gleason from the U.S. Chamber of Commerce, and he will be discussing updates regarding the CARES Act, as well as the U.S. Chamber's Path Forward initiative. If you should have a question today at any time during the broadcast, then just please click the Q&A button in the lower middle portion of your screen and then type your question. And without further ado, I will hand it over to Ryan.
Thank you, Miranda and Jessie, and thank you for all that are attending. I think I was with some of you on Monday, and while that was only 4 days ago, it feels like 4 lifetimes ago in the way that the world is working today. So as Jessie alluded to, I'm going to kind of give some updates of the bill that was actually signed today by the president, and then our newest initiative, which is a path forward, which discusses what return to work looks like. And Miranda and Jessie, if at any point you can't hear me well, feel free to give me a shout out. Okay. So as I said, quick updates regarding the CARES Act of what's going on, and then return to work. So the Paycheck Protection Program, the PPP, the loans to date, as you can see there's roughly 1.7 million loans are approved by the SBA. Nearly 5,000 lenders, which are mostly local, your local banks or credit unions, made these loans. 75% roughly of these loans were $150,000 or less. And the average loan amount was just over $200,000. But today, so then I'm sure we all heard in the news, there was this new legislation that kind of was put forth this week, and President Trump today signed nearly $500 billion for the coronavirus bill. That includes money for the small business program, as well as money for hospitals and testing. So to put in perspective, roughly $2.7 trillion since the CARES Act was passed 4 weeks ago has been approved by Congress and the president. So this bill was passed by the Senate earlier this week by a voice vote. The Senate did not come back into town, and was approved by the House on Thursday, 388 to 5. Very, very bipartisan vote. So what the bill included, it was roughly $310 or $20 billion to the Paycheck Protection Program created by the CARES Act, which was passed 4 weeks ago today. The program, as we all kind of understand, quickly ran out of money because of the high demand. And it provides forgivable loans to small businesses who keep employees on their payroll. We do expect, though, this money to go very, very quickly as well. That's why this was kind of known as an interim plan. But about $60 billion of the additional PPP funding will be set aside for businesses that do not have established banking relationships, such as in rural and minority-owned communities. We saw a large problem there where they were not able to get access. And there's an expanded access to aid. The expanded access was a big priority for Democrats, who were worried that some businesses were being shut out of the fund. The bill also provides $60 billion in loans and grants for the Small Business Administration Disaster Relief Fund, also known as the EIDL Fund. $75 billion for hospitals. There was $25 billion for testing for the coronavirus. But this did not include additional funding for states and local governments that Democrats had fought for. So although the bill nearly totals $500 billion, both parties have been referring to this as an interim piece of legislation meant to bridge the gap between the $2.2 trillion in CARES Act and the next expansive round of the coronavirus, which would be a phase 4. So what was signed into law today wasn't really a phase 4 bill. As we were hearing about these different phases. It's more of a interim bill of 3.5. And so what does the next phase 4 look like? Well, first off, Congress doesn't return back until May 4th, where they're all back in D.C. That is really when the process is, it's already beginning behind the scenes, but in front of the public about what the next phase 4 is going to look like. I wish I could give you a better idea, but it's like throwing pasta on the wall and seeing what sticks. We still we really do not know. Okay. So something really exciting that the U.S. Chamber put out last week was a national return to work plan known as a path forward. And so I'm going to run through you what planning looks like, implementing and supporting. And so the biggest question in the minds of a lot of people right now, government leaders, health officials, employers, the American people and their families is, what will a return to work look like? Because we're seeing a lot of that in the news today. So that question can't be answered really in one question, let alone one answer. It's becoming more and more clear that we won't come to a picking up where we left off. So instead, work will be gradual, phased in, and of course, it's going to vary by location, sector, business type, and health status of workers. And as I'm sure if you saw or read about President Trump's opening up America again, so it will continue to require social distancing, the expanding use of PPP, protective personal equipment, and masks. So, what is needed to return? To help business and government anticipate the challenges that we might face, us at the U.S. Chamber, we began to explore and catalog some of the major implications of returning to work in this environment, ranging from workplace safety and employee rights to liability concerns and continued revenue disruptions. So as you can see here, some of our initial thoughts are detailed through first essential services and resources, regulation of and legal liability issues, and support for businesses and individuals. Okay, so what do essential resources look like? So first is general health screening. So the CDC recommended that some employers screen certain exposed employees for temperature, ideally before entering the facility or a business. So if this recommendation is expanded to cover all employees and potentially customers, employers will have to acquire temperature checking equipment and develop a process to screen individuals. But how are they going to pay for it? I mean, there's other general health screening concerns as well as the use of potentially other equipment. Next up is COVID-19 testing. So most employers are probably not well positioned to administer these medical tests. So there's probably going to have to be a widely accessible third-party providers, potentially a new industry here. Plus, more than likely, these tests are going to have to be frequent. Frequent testing probably, if not definitely, is going to be costly. So again, who is going to pay for it? How are those costs going to be determined? All right, as I kind of alluded to, personal protective equipment, PPE. So if public health professionals recommend widespread use of PPE, such as masks, it will require clarity as to what is needed and who is responsible for providing such equipment, especially if shortages persist, as we've kind of seen in your local grocery stores or convenience stores. Next is transportation. So roughly today in America, 8 million Americans rely on public transportation to get to and from work each day. So public transportation obviously is efficient when it maximizes who it can service, which needs to be avoided during this time of social distancing. So while staggering work times such as examples, employees A start at 7, employees B start at 8 a.m., and employees C start at 9, this can help spread out the rush hour. But transit systems will require likely some form of financial assistance in order to support a safe return to work. And so lastly, for essential services and resources, and perhaps most important, is childcare. So in order for other parents to return to work, children will need childcare. Childcare providers will likely need to operate under suboptimal financial conditions. Obviously, they're going to be below capacity levels, as not all employees will return to work at once. And with increased costs to maintain social distancing and accommodate staggered work times. Child care providers will likely require some form of temporary financial assistance and in recognition of the fact that they will need to operate at a loss in order to allow parents to return to work. So again, where will this funding come from? It's going to be local, state, or the federal government. Okay. So reopening a plan that's medically based and relies on social distancing and other best practices for public health may raise significant regulatory and legal liability risks. These are in addition to numerous lawsuits that have been filed as a result already because of COVID-19 and litigation risk is more than likely going to become worsened during a reopening period. So first off is health privacy. Obviously, individuals prefer to keep their health private, but maximizing individuals' health privacy could conflict with potential reopening requirements, and employers that need to verify an employee's COVID-19 status and or other vulnerabilities due to other underlying health conditions. If they had a history of pneumonia, the common cold, etc. So also there's going to be discrimination claims. For example, employers who conduct a medically based or risk-based reopening using factors such as age, underlying health conditions, may face liability under anti-discrimination rules. For example, we already have the Age Discrimination in Employment Act, and then there's anti-discrimination provisions with the Americans with Disabilities Act. As most of us know, the most vulnerable population is for the age of 65 or older. And so what is that going to look like when return to work looks like? Can an employer tell an individual who's 65 or older, you cannot come and work? So also employers could face claims for adverse employment actions by employees who are delayed in returning to work and who feel that they are not provided other reasonable employment accommodations. At the same time, employers can likewise face liability if they return at-risk employees to work too soon. That's a big question. In addition, there's going to be more safe workplace requirements and resources will be necessary. So the Occupational Safety and Health Administration requires employers to be responsible for ensuring the availability of equipment like PPE and training employees of the use of that equipment. That would not be possible if PPE becomes recommended in all workplaces. I'm sure most of you, like me, do not have personal protection, PPE masks in our workplace. So what will that look like? So we're going to need to support independent contractors during this time. Businesses want to be able to provide the same type of workplace protections to independent contractors as they do for their employees. But how does that employee and independent contractor separation look? So there's going to be change to employment practices as well. So employers could face liability around wage and hour issues. So think about this, for example, if employees are employees compensated while getting tested or passed through screening for COVID or other sort of testing that might be required. There's going to be change to leave policy, travel restrictions, telework protocols, and worker compensation. Also, employers could risk legal actions if they do not accommodate employees who either insist on returning to work even though they have not completed health screenings or are high risk, or simply who refuse to return to work and provide proper support for such refusal. So next up, there's a number of exposure liabilities, product liabilities, and medical liabilities that I could go through, but exposure liability is perhaps the largest area of concern for the overall business community. There's multiple claims that could be brought against businesses that are designated as essential, as well as large swaths of remaining business community once the economy is reopened. The core component claims in this category is that, did a customer, employee, patient, member of the public, et cetera, were they exposed to COVID-19 in the business facility or as a result of the business's particular action or failure to act? And then that claimant became sick. So legal theories underlining these claims may range from simple negligence to strict liability to public nuisance, in which plaintiffs' bar could try to pursue these contingency fee arrangements with cash-strapped states and municipalities. But it's really difficult to prove these, though, through legal scholars, these sort of claims. Next up is customer communications. So businesses today are increasingly communicating with their customers more by reaching out via telephone calls or text messages, which will be critical, especially in this time of social distancing. But this is currently being threatened by litigation under the Telephone Consumer Protection Act. So how will that play out? How will businesses be able to reach out to their customers if they simply cannot reach them via text message or telephone calls? And additionally, there are undoubtedly going to be issues with the False Claims Act as well. Okay. The next slide here for support for businesses and individuals. So we've seen the federal government, such as today, take unprecedented steps to support employers and individuals during this current shutdown. But these programs will need to be modified, as we sort of saw today, and to the extent extended to assist those businesses and individuals who remain under distress under a phased or gradual reopening, including that additional $500 billion that was signed by the president today. But first up are businesses that are dependent on high-density gatherings or travel. So entertainment venues such as movie theaters, concert halls, restaurants, bars, companies that host meetings and events, and other businesses are not profitable when they achieve this type of occupancy and density is not possible during social distancing. So in addition, many businesses rely on businesses, trade show, and personal travel that may be greatly reduced based on social distance guidance. So a gradual or phased reopening that restricts the size of gatherings or limit the travel may technically permit these businesses to reopen, but that will mean operating at a significant loss during a period where the occupancy and gatherings are numerically restricted. So these businesses should be provided a bridge to assist them to be able to remain viable once eventually and hopefully we get back to normal. So next there's obviously going to be individuals that are delayed in returning to work. So until there's a widely available vaccine or a widely available treatment or effective treatment for those who fall ill, not everyone is going to be able to resume to normal work activities. High-risk populations will need to engage in social distancing or remain at home entirely. Individuals, including contractors who must stay at home because of the risk profile, will need ongoing financial support if they cannot work remotely. This will require an extension of regular unemployment insurance, or perhaps we could see a creation of a new high-risk unemployment insurance system. And finally, and it goes without saying almost, it should remain the case that if a business operating optimally remotely should remain remote as well during these times. So we're going through all these considerations for a phased reopening. This is where, for those on the call, perhaps like your input, what additional services do you see is necessary to support a phased reopening? What additional resources do you anticipate needing to operate during a phased reopening? What additional guidance, specific regulatory guidance from the federal government would be beneficial during a phased reopening? What additional legal liabilities are you concerned about during a phased reopening? Do you anticipate businesses needing additional financial support to bridge a phased reopening? And if so, what form should that take? How have you changed the way that you operate your business as a result of COVID-19? And, what changes do you anticipate continuing after this pandemic? Has anyone here benefited from federal support, including the SBA's Paycheck Protection Program, implemented since the onset of this pandemic? If so, which of these programs, and do you have feedback on these programs and the federal response? Are there changes that you would recommend? What do you envision that you're going to need going forward? For example, some types of standing support for business interruption during the case of pandemic. How concerned are you about potential costs of each support? And, kind of the last question that we're having is, while restoring the economy will be a matter of private sector employers being able to resume activity, what other role should the private sector be playing? And what hindrances do you see as a way to affect these efforts? What else are we forgetting to ask? So if you're not able to ask the question now, I would suggest that you provide feedback and questions to us at returntowork@uschamber.com. The biggest thing, though, Miranda and Jesse, that we are concerned about is at the Chamber, what it's going to look like with regard to, is this going to become more of a social guidance, or is this going to become a regulatory thing where you have these regulations coming out suggesting, you have regulators coming into businesses? Do we have individuals so far apart? Do they have all these things in place this could become a huge mess in the business community, and that's why we at the Chamber are pushing for guidance as opposed to regulations. And with that, I'll turn it back to you in case there was any questions with regarding to the program that was passed today or anything to do with the Path Forward initiative.
So as Ryan mentioned, he offered that email that you can provide your feedback or any questions that you might think of in the future. But for right now, does anyone have any questions at all? It's your time to ask them. Just click on the Q&A button at the bottom of your screen.
And again, it was return to work at uschamber.com, return to work at uschamber.com.
We have one question. The question is, we are receiving the payroll protection funds, but are concerned about the quick timeline to return the employees to work. We are concerned employees may not want to return to work now because they are getting unemployment and the additional $600. Can we pay employees that do return overtime? So I think the question is, can they use the PPP funds for overtime pay?
So the PPP funds are, the way that your payroll is constricted, it does include overtime pay. So those individuals, even if you're able to pay those individuals, they should be being paid because that would imply that they no longer be eligible for unemployment insurance. And essentially what unemployment insurance, what this is doing, the government is paying small businesses so they can pay their employees. And for every dollar spent on unemployment is a dollar saved through the Paycheck Protection Program.
Does anyone else have questions? Again, like Ryan had mentioned, you can shoot an email to either one of us, Miranda or I, and we can forward it on to Ryan if you didn't get that email jotted down. Oh, we have one more. It says, I received PPE funds. What additional programs came from today?
So there were no new programs that were announced. We're talking about for small businesses. There was just additional money that was put into the Paycheck Protection Program as all the funds were exhausted last Thursday. So we're encouraging folks that may not have gotten these funds to continue applying for these funds, specifically through your local lenders. But in addition to that, additional money was put into the EIDL loans, the Economic Injury Disaster Loans, some $60 billion. And then the big focus was how much money was put in for hospitals and continued testing. So no new program was established. And we hope to see more programs in a much bigger package as we saw, kind of the CARES 2.0 and a phase 4 for when, again, Congress returns back in early May.
Thank you. We had another question come in. It says, what if someone refuses to return to work? We are deemed essential and have had a lot of people working already and have now received the PPP and are in the process of calling everyone back. One person stated they were not coming back until the governor releases everyone.
So an individual, that individual would not be eligible for unemployment insurance. I can't speak there's going to be specific guidances for each state, particularly in Ohio. I know that Ohio is moving very fast with a beginning to reopen on May 1st. There's also, as I said before, these are some of the workplace liability issues for an employee that refuses to come back to work, but I cannot speak specifically to what Ohio has put forth in guidance on that.
Just for 1 second, I wanted, if you could talk a little bit more or encourage those who haven't applied for the PPP. We are considered economic hardship county. So is that 60 million that they set aside for, is that like directed towards towns and counties like ours?
So the Economic Injury Disaster Loan is for anyone. I don't want this to be confused with our Small Business Initiative Fund that was on Monday. That was strictly through the U.S. Chamber Foundation. and was through donations. That's $60 billion for anyone in America, because right now America is going through an economic disaster. And I believe that economic disaster is held through July 31st. So it doesn't relate to any specific town or county or state. It's everyone in America is eligible for that loan. Every business, I mean, rather, but.
Okay, we'll just give you a couple more seconds to type your questions in here, if anyone has any. And while we're waiting, I will show you my co-host here. This is Lady. Looks like we had one more come through. It says, my local lender is reluctant to answer any questions about the documentation for forgiveness and when the 8-week clock starts. Can you give us a resource?
Sure, Kim. As to the first part of your question, I don't know off the top of my head. If you want to reach out either to Jesse or Miranda, I'd be happy to get you that information. But the 8-week clock starts is when the money is put into whatever account that you have. It's not once you have approval. It's once you have the money that is in your account.
Okay, does that answer your question, Kim? Okay, good. All right, so if nobody has any other questions and no other comments to make, again, we encourage your feedback. That can be forwarded right on to the officials that make the decisions. And this will be made available on the Galion-Crestline Chambers YouTube page. And we will share it on both of our Facebooks after the fact. And we had a thank you. That was so helpful. So you're welcome.
So
Ms.
I guess Jesse, Miranda, for everyone that's on the call, just because Ohio, specifically kind of in this Great Lakes region that we're in, if you're hearing anything as this reopening begins, if you could begin to tell Jesse and Miranda, and then if you could funnel that to me, I'd love to hear what people are hearing, doing, how they're adjusting, problems, no problems, if any. That'll be really interesting to hear as we kind of formulate it into a national reopening plan. And then lastly, as a reminder, hopefully the next time that I could be with you is when the next extensive plan is put into place in Congress. It'll probably be a couple of weeks before this one actually goes through, as opposed to the CARES Act, which was passed in a matter of days. Where there's going to be funding, if there's going to be new programs for small businesses, self-employed, independent contractors, and et cetera. But if there's no other questions, I really appreciate being on with you again this afternoon, and I look forward to the next time that we speak again.
All right. Thank you, Ryan. Thank you, Miranda.
Thank you.
All right.
Thank you.
Everyone have a good weekend.
Bye-bye.